let's look at section 15, which considers disorders of the pituitary gland. And so here, session overview, the pituitary gland is the master gland of the endocrine system, and this session examines the abnormalities of the pituitary function, mainly hyperpituitarism. We have the hypopituitarism and then diabetes insipidus. And at the end of the session, the student should be able to differentiate between hyper and hypo secretions of hormones by pituitary gland, and then recognize the clinical manifestations of both hyper and the hypo secretions of the hormones, and then identify and manage patients suffering from diabetes insipidus. So topic 1, we look at the acromegaly, and then the topic 2, diabetes insipidus. And we look at acromegaly first. Acromegaly is a syndrome that results when the pituitary gland produces excess growth hormones, GH, or somatotropic hormone, or somatotropin, after epiphyseal plate closure is observed. And then acromegaly literally means enlarged extremities as a result of GH hypersecretion after puberty, most commonly because of the pituitary tumor. And so normally growth hormone stimulates the growth of bones, muscles, and other organs by increasing protein synthesis in many tissues, and that is, it facilitates entry of amino acids into the cells, and this helps development and growth in general. And so thus GH promotes growth of bones and other body tissues by stimulating protein synthesis. GH also suppresses utilization of carbohydrates as an energy source, thus causing the level of glucose in the blood to rise because glucose utilization is reduced. So what happens is that GH increases breakdown of fats to fatty acids. Because of this, it has been promoted as an aid to weight reduction with little evidence. In acromegaly, as a result of excessive secretion of GH, bone and then connective tissues continue to grow after puberty, and so it involves overgrowth of soft tissues and then terminal skeletal structures such as the nose, jaw, forehead, hands, and then feet. And therefore, the forehead enlarges, the maxilla lengthens, and then the tongue enlarges, and then the voice deepens in that particular individual. So additionally, excessive GH exaggerates the normal depression of the carbohydrate metabolism, and so GH is also said to induce insulin resistance, and then insulin resistance in muscle cells reduces glucose uptake. Therefore, impaired glucose uptake and diabetes mellitus may also evolve in this particular individual. So acromegaly most commonly affects adults in middle age and can result in severe disfigurement, serious complicating conditions, and then premature death if unchecked. And so premature death rate mainly related to cardiovascular disease and complications are common. Because of its insidious pathogenesis and slow progression, the disease is hard to diagnose in the early stages and is frequently missed for many years. Symptoms or clinical manifestations in general, features that result from high level of GH or expanding tumor include soft tissue swelling, visibly resulting or leading to enlargement of the hands, the feet, nose, lips, ears, and then a generalized thickening of the skin. And so soft tissue swelling of internal organs, notably the heart, and then with the attendant weakening of its muscularity, and then the kidneys, also vocal cords, resulting in characteristic deep voice and slowing of speech is also maybe also observed. And then generalized expansion of the skull at the frontal. We may also have pronounced brow protrusion, often with ocular distension, and then pronounced lower jaw protrusion with attendant macroglossia, which is enlargement of the tongue, is also likely to occur in individual. In addition, there are effects of tumor or mass effect on the brain and other skull structures, and then damage to the nerves. It can also cause severe headaches, seizure, and visual disturbances. Untreated acromegaly can lead to premature cardiovascular death. Causes, we have pituitary adenomas, and then we can also have other possible factors which you have to read around it. And then we can also have the diagnosis pointing on radiographic testing and then biochemical testing, in addition to analysis of changes in physical appearance which are used to diagnose the acromegaly. We can have the skull, hand and then foot X-ray studies along with CT scan, which are studied for pituitary fossa enlargement, and also we can do characterized bone changes of the skull and then extremities assessment. And then visual field testing and then fundoscopy are also performed to search for tumor pressure on the optic chiasm. And then serum GH may also be normal from 0 to 5, and then also elevated, however, levels of serum somatomidin or SMC and then DA dependent polypeptide are elevated in almost all patients with acromegaly. And then other tests can also be done. Other pituitary hormones have to be assessed to address the secretory effect of the tumor, as well as the mass effect of the tumor on the normal pituitary gland. And then they include TSH, which is the thyroid stimulating hormone. We can also do gonadotropic hormone, which is the FSH, and then LH, and then SETH, which is the adrenocorticotropic hormone. And then we can also check for prolactin, and then other tests may also be done. Treatment, the goal of treatments are to reduce GH production to normal levels and to relieve the pressure that the growth pituitary tumor exerts on the surrounding brain areas, and then to preserve normal pituitary function and to reverse the symptoms of acromegaly. And then currently, treatment options include surgical removal of the tumor, drug therapy, which is a pharmacotherapy, and then irradiation, which is a radiation therapy, and then of the pituitary. Surgery may also be done, which is a rapid and effective treatment of which there are no two alternative methods. The first method of procedure, known as the endonasal transsphenoidal surgery, involves the surgeon reaching the pituitary through an incision in the nasal cavity wall, and then the wall is reached by passing through the nostrils with a micro surgical instrument. So these ones, you may be able to look at these things under surgery. So I've already provided some notes here, which you can take your time and then go over from time to time, and then just become used to. We also have the radiation therapy, which has been used both in primary treatment and then combined with surgery or drugs. Routine complications of the condition of acromegaly we have the severe headaches, repeated headaches, continuous headaches in affected individuals, and they may complain this several years. We have enlarged heart, we have hypertension, diabetes mellitus, and then heart failure, and then kidney failure can occur in these particular individuals. And the nursing care centers on the following. I want you to read on these ones. I've provided the notes for you. Body image, anxiety related to, and then coping, and then support of these individuals is very, very important because of the condition. And then we also have pituitary gigantism in children. I want you to look at this once. I've provided this, not a common case. Diabetes insipidus is also about 60 to 80% of human body is composed of water, and the osmolality is one of the several factors that regulate fluid balance between intracellular and the extracellular fluid compartment. Excess excretion of water can also lead to high osmolality and then dehydration and then thirst. And then you have to read on antidiuretic hormone, covering the following areas. What is antidiuretic hormone? Where is the ADH formed, and then where is the ADH stored, and the ADH is released in response to what? What are the functions of the ADH? And then once you have done that, then you can go through this condition by looking at the diagnosis definition, and then look at the types. We have the central one, and then the nephrogenic one, and then the causes, idiopathic infection, tumors, and the head injury, and then familial, and then causes of the nephrogenic D1. We have the causes there, and then you can take your time later and then go through with references. Thank you very much.